I'm Dr. Mandy Yap. I'm the clinical hematologist from Malaysia. I'm currently here in Asia Pacific Society of Fish and Blood Management.
We're here at the ASPBM conference in Bangkok, Thailand.
This is a great place to be. This is a vibrant city, and more vibrant are the discussions and the conversations that we're having here. People have been sharing their success stories, their challenges, their strategies. Definitely everybody is taking home some point.
Our blood is an organ, and it's part of the largest integrated organ system in the body.
I don't know if you can hear the noise in the background. When you're here and you get to interact and interface with different specialties, different doctors, and you realize that they have one thing in common. They want what's best for their patient.
We encourage patients now to be a part of the shared decision-making process. Don't feel like you can't ask questions.
The best outcomes come from patients who explore and ask questions. They get the answers, they get the best treatment, they spark their clinicians to think a little bit deeper.
I grew up in a family I have 4 sisters. I had a sister recently get an iron infusion, or convinced her clinician after having a look at the Bloodworks book, went over the chapter on anemia. She was on an iron supplement for 3 months, full protocol by the doctor, changed her nutritional habits, but has a problem with iron absorption. 20 years later, she gets her first iron infusion and feels better than she has her whole life.
I think this blood health concept has brought up a lot of women to speak about their menstrual bleeding, which is normally not mentioned among all the Asian women especially.
Depression, postpartum depression, is linked to iron deficiency.
We found extraordinary results that whenever we replaced iron effectively and efficiently, the women had no postnatal depression.
Grandmothers, we just dote on on your grandchild, but you don't talk to your daughter or your daughter-in-law, for that matter, how you yourself feel.
Blood health is a conversation that we can have with our friends. It's a conversation we can have with our doctors who may or may not be so aware of this problem. And in this way, we can improve the health of not just ourselves, but of others as well.
So is there a problem with anemia in teenage women? Yes. Is there still a problem? Yes. Do we need to talk about it? Yes.
I see it every day that women, they look past maybe some of their symptoms. They don't speak up for their health.
Most young adolescent girls and women, they don't take heavy periods seriously.
I have gone through a miscarriage with a twin. I think I lost about a liter plus blood. Please don't ignore all the significant blood loss that you have. Please get your doctor and ask for help.
The public, the patient should be empowered to take care of themselves, their blood health.
We can all have an impact on perceptions around blood health. For healthcare professionals, even if you feel like you're alone, you're not. Make yourself aware of issues around anemia, around blood health. Spread that information to your colleagues.
If there is no PBM program in a hospital, it takes only one individual, a PBM champion, to start the ball rolling.
Even if there's not an organized initiative, you can still impact every single one of the patients that you take care of and every single one of the colleagues that you interact with.
So many, many successful PBM programs around the world started with one person.
If they get one little piece of information that improves their awareness to ask the right question, to get a blood test, to perhaps make an adjustment in their blood health, then it's a total win.
The vibrations of this knowledge, the exchanges, they are in the air around, and you cannot get it in your screens.
I think it's a real privilege to be a part of it, to soak it all up.
Let's do it.